Given the early evidence we have on this new variant of the virus, the potential risk it poses, it is with a very heavy heart, I must tell you, we cannot continue with Christmas as planned.
When we talk about mutation, it means that what normally, all these viruses, they are made of some sequencing of protein. The protein sequencing is changing. So that's the meaning. So normally it was a particular fashion of protein. With mutation, the arrangement of protein has changed. So what is happening is basically, it means two things to us. Firstly, that the gene sequences is changed. So the test which is available will not pick up that kind of a mutation. And also what is thought is basically, in UK now it is causing more of infection. Close to about almost 60% of their infection is related to this kind of a mutation, which is called BUI 2020.1. So that is the the sequence number which is given.
For Christmas, essentially, you could create a social bubble with your close friends from different households and meet them over Christmas. But now, due to rapid cases increasing all over the country, these mandates have been essentially axed in areas heavily affected by the virus.
Christmas restrictions are varied across England and across the UK. So if you are in a tier 4 area, then you can only do Christmas with your household or with your support bubble or your childcare support system. If you're, for example, if you're living alone, you can form a support bubble with another household so that you are not completely isolated, but you're not supposed to go beyond that support bubble. You can't create a support bubble with multiple households.
Okay, so the current situation came as a total surprise. Even though London was placed in Tier 3 starting December, it came as a total shock when Prime Minister Boris Johnson announced London would be put under Tier 4 on the 21st of December. When the enforcement is not such as that you're going to get pulled up randomly, it's like one could leave the house, go to the park for a walk, exercise in open areas. There's no system where one needs to get a pass from the authority for movement. Although there are travel restrictions that one cannot leave the Tier 4 area unless for work, but the government is enforcing it on the basis of trust of the citizen.
For example, in London, the hospitals are up to 90.4% capacity. The capacity of beds in ICUs is going up. There are healthcare worker shortages. There is healthcare worker fatigue because they've been dealing with this now for almost a whole year. So there's been an exponential rise in cases since November, which is also attributed to this new strain, of course, which is why there have been travel restrictions and bans by several countries, including India, on travel.
People are saying that this virus was already there perhaps in September with us and it was not picked up because of the test. So we are not very sure. We need to be first 100% sure whether are we missing the virus. It was already there because the flights from UK were all on. It's not that it were not. We've been a little more vigilant in the last few days. Otherwise, maybe people were coming and we were not picking up because of the test, which was not very sensitive. It was not made for that test.